watching and for your efforts in educating the public and increasing their awareness. The situation, of course, is changing, and this is something that's expected because it's happening in many countries. As you know, there are more than 100 countries around the world that are now affected, and Qatar is one of them. So what has changed is that we started seeing cases in the community who don't have recent history, history of recent trouble. Yesterday we diagnosed 3 cases, and that was announced. I was among expatriates. And today we diagnosed 3 more cases who are contacts of the previous 3 cases. And this is a demonstration of the effectiveness of the public health measures that are implemented, because with the discovery of the 3 cases yesterday, the Ministry of Public Health started immediately implementing early detection and containment measures through contact tracing. So they traced all the contacts of those cases from yesterday, whether at the residence or at the workplace, and they screened many contacts and put them on quarantine. The results of the laboratory screen was positive for 3 of them, which is not a big number, so that's somewhat reassuring. But the investigation and the contact tracing is still going on. All the 3 were admitted under isolation, and they are in good health condition. I would like to mention that also our other patients are in good health conditions, the previous ones that we diagnosed over the past days. So I would like to take this opportunity to say that adhering to protective personal hygienic preventive measures are more important now because we are seeing the virus in the community. So frequent hand washing, avoiding touching your eyes, nose, and mouth while you are outside of the house, using alcohol or similar hand sanitizers when you are outside of the house, avoiding visibly sick people, avoiding crowds possible, and when you are sick, if you have respiratory infection, to make sure you don't infect others, because now it's your responsibility. You may be young and healthy and God forbid catch COVID and you don't know it, you think you have common cold, but you may infect others who may get serious complication from the virus. So those measures are really important. At this point, we also recommend, particularly for older people and those with chronic conditions like heart disease and lung disease, to avoid social gatherings, to minimize social activities, minimize having to go outside for one reason or another unless they have to. We also advise people to avoid unnecessary travel at this time until things settle down, because there are many countries who have the virus spreading. Again, to emphasize, those 3 people who were diagnosed today are in good general condition, and they are under isolation and on treatment. So with that, I will stop and I'll give the microphone to my colleague, Dr. Mohammed.
We are here to answer always, to stop the rumors as early as possible. So we are planning to have a daily update if needed. But please sometimes wait for us some hours to assure that our information is very accurate and get everything you need. So it doesn't come in pieces, it comes in very clear one, because we do our right investigations. We are sure that, alhamdulillah, Qatar have a very advanced healthcare system that ranked as 5th in the world on legislative index, and we have the staff from Ministry of Public Health, secondary care and tertiary care, primary health care and secondary care and tertiary care are working together, plus all the ministries are having interministerial meetings to assure everything is on hand. We are taking many decisions now just for precautions. Some people maybe can say that some of these things that disrupt their system or their plans for traveling or something, but we just to assure that we should be very cautious now, and we work together to assure that our people has get the awareness needed for them during this period, and inshallah things will keep going on later in a better situation. But you need to have a break a little bit, think about everything, everybody is aware, and we can move on. The other thing that we're discussing about the COVID, we have countries now, inshallah, with 1,000 cases with no deaths. Some people, it can be critical, but to assure you that there is some think positive, helping people to keep protected. But the quarantine can affect every person. So I would like to assure that for high work, blue colors or white colors, if you have been in contact or you have the disease, you will be quarantined. I think most of you don't want to be quarantined during this important period. So I would like everybody to be cautious and take, as Dr. Abdullatif mentioned, the precautions needed to assure things go, but without panic. Keep it in the right direction, keep it firm in a balanced way, and inshallah everything will be there. And you have any additional questions, you can call 16,000, and you can send your any questions on our Nisma'ak or Labe, our programs. I will send and I will answer you inshallah as soon as possible. So don't keep these things growing. Any rumors, we want to stop it as early as possible. Please send us all your questions so we can reply in our update plans.
First, I would like to assure you that we are now in the early stage of the discovery of local cases here in Qatar. Cases were discovered among expatriates working mainly in wholesale market and also in another hypermarket. So we have decided to temporarily to close those places and to ensure that tracing all close contacts, we traced more than 200 or 300 persons to screen them, and with this measures we have discovered 3 more cases today. So we will continue tracing another close contact for the 3 new cases, and we have taken, as I mentioned, to close this premises temporarily and to ensure that to take all the precautions and to decontaminate them. All the close contacts will be in quarantine for 14 days. Also, I would like also to assure you that from our side, we will communicate always maintain the communication with the public through press conferences, statements, and also our call center 16000. It's 24/7, and we will post any update about the situation also on our website for all guidelines. We are producing different guidelines for healthcare facilities, for disinfection of non-healthcare settings, for educational, religious, sport mass gathering. So all of these guidelines will be available in our Ministry of Public Health website.
So the coming stage now, we are gonna trace every case and contact, and we need your help through different embassies and different media in different languages. If you can translate this to many languages, ask any person who works in Qatar. If you ask him to come to be tested, you should be collaborative, because this is something for his value and the value for people around him. So please, from now, with your help, with your influencer, let's help people to collaborate with each other to assure that we can control the spread as soon as possible.
Thank you very much.
Thank you very much. Thank you.